in breast augmentation, do you have to have scars under your breasts? Perhaps you could put the scar on the side of your breast instead. Yeah, you're absolutely, no, you don't have to have it on the under your breasts. You can have it kind of on the side. Actually, the armpit is a relatively popular thing, certainly worldwide. It's a popular way of putting them in. It's called transaxillary. The other way you can put them in is infraareolar, which is like a U-shaped, half-moon shaped incision on the bottom of the areola. So those are the three kind of common routes to insert implants, and they've all got pros and cons, and understand why you might not want them in the under your breast in the fold, because it can be visible. It's quite hard to see. You have to kind of lift up. You know, I understand it might be visible. So therefore, the transaxillary approach is preferable in that regard, because it's in your armpit. But if you, it really depends on the surgeon as to what you're familiar with. And I think most surgeons in the UK do the what's called the inframammary approach, which is in the fold of your breast. And it's certainly the way I do it. And I don't do the transaxillary, the armpit one, because I would struggle to create a cleavage. You're quite far away from the cleavage area, which is quite an important area to make a nice pocket when you're doing the surgery. And you're quite far away if your incision is in the armpit, and it can be difficult to control the bleeding. There's some quite big blood vessels around the cleavage area, and that's what worries me. That's why I don't do it. But there are some very good surgeons who do it, so I'm not saying it's bad. It's just, that's just me. Admittedly, most of the surgeons are overseas for whatever reason. I don't know why the UK doesn't do transaxillary, but I know people overseas in Europe who do a lot of transaxillary. It's popular there. So it's one of those ones which, I guess, it's like many things. If your surgeon is confident with that technique, then that might be the right thing for that surgeon to do. Certainly, when I've had patients come and see me and want a transaxillary approach, I'd say no, really, because it's not something I've done, and it's not really something I'm confident doing. And so I feel like my expertise is the inframammary approach, and you might find someone else who's got expertise in the transaxillary approach, who's maybe hasn't got expertise elsewhere. The infraareolar approach is, I sometimes would do that. It's a very common approach for accessing the breast in men, and sometimes you put implants in from around the areola, but I don't routinely use that one either. For some reason, in America that's popular. So why infraareolar is popular in America, transaxillary is quite popular in Europe and the UK. We do inframammary. Just shows you there's no right way. We're all gonna argue our corners, but I don't think any of us can say it's the best way, because if we could, then everyone would do it that way. So the answer is yes, you can put it on the side of your breast, or at least in the armpit. But the trick is, we find a surgeon who'll do it for you. Certainly in the UK, I don't really know anyone who does it regularly, but I guess there's probably someone out there.